Hi, I'm Dr. Jeff Waldron. Today I'm going to talk about poor posture. In this discussion, I'm going to talk about what causes bad posture. I'm also going to talk about why it's bad for your health. And then the third thing I'm going to discuss is how to correct your posture and what you need to do for that. So the first thing is what causes bad posture? And there's a lot of things right now in society that we're doing that tends to force us into bad postures. The big ones are devices. So a lot of people are at home working on laptops, utilizing their phones. You see people walking around, they're walking with their phones, looking down like this with their lap, and they're training their neck and their eyes and their entire spine to go into these positions. If they just took a moment and put the phone up at eye level, then this would be much better for their neck, their eyes, their back, than being down in this position. Additionally, people are sitting too long. We're driving in cars, we're sitting at home watching movies, Netflix, streaming, doing all these things for hours and hours, and that's contributing to these poor postures that are really impacting our health in a negative way. When you sit down at home and you want to relax and you decide, oh, I'm going to get a little work done on my laptop, I'm going to sit down, and now you're in your lap like this, elbows maybe out, head down, working away. This is starting to pull on your neck and create significant issues. You're training your spine and your muscles into this position. A lot of people get in a recliner or their feet up on ottoman, crossing their legs and doing this. And then they're wondering why they're waking up in the middle of the night with their legs tingling with sciatica, plantar fasciitis from a pinched nerve coming out of their back from this kind of posture. Or they're sitting with their legs crossed in this figure four position, trying to do a variety of things, such as sitting on their phone, doing this, elbows out, crunching up their neck. So there's a lot of pitfalls and things that we're doing in society that contribute to our posture. We're also sitting way too much. So we're leaning back in chairs doing this, and our head thinks this is a good position to be in, semi-reclined. So then people come in and they're standing, and their posture's like this because their back is used to the support of a chair pushing on them, so they're back here hanging out like this with this kind of posture, and they think, hey, I'm nice and straight, when really we should be standing like this. We're designed to stand over the arches of our feet and not hanging out over our heels. We're designed to squat and get in different positions and not be hanging out back here, but instead engage through our abdominals and not compressing our backs of our hips and so forth. So lots of reasons why we're getting poor posture in society, and we need to really look at this because it's really bad for your health. It tends to cause back pain, like I was saying, sciatica, could cause foot pain, could cause headaches, neck issues, and it really is death by 1,000 cuts, because you may be able to tolerate for 5-10 minutes, but now 2 hours, several times a day, or 8 to 9 hours, and all of a sudden you look in the mirror and you start to see your body shifting and changing and starting to hold some of these things, and you don't realize it because your brain thinks now this is normal. But if you go get up against the wall or do something and see how straight you are, you may realize you're really slumped forward. So this poor positioning can cause musculoskeletal pain, headaches, back pain, foot pain, elbow, wrist, and hand pain. It also can start to impact your balance as well. If you're tipped forward like this and you go to stand up and walk or do things and your eyes are used to looking at a screen this close, all of a sudden you have a hard time adjusting, and I see people have falls, and so now they're at fall risk, and this can be bad when they're trying to get up and get around because they're slumped forward. It also aesthetically looks poor. If you're walking around like this is not the most appealing posture to say, hey, I'm confident, I'm feeling good. You want to be here, and it's going to really put your best foot forward and look much better to be in that position. It also helps you breathe better. It's better for your system to move, because if you've taken up slack in one direction, you lose mobility in all other planes. So now your shoulders aren't able to move well, you're stiff, versus if you're upright, you're able to raise and move your arms, reach, twist, bend, and do some things. So poor posture can really negatively impact your health, and it may not be the first time you do it, but over time it will creep on and get worse over time until all of a sudden you start to have all these issues and you're not really realizing why, because it was gradual and it came on through accumulation. So the third thing that I'm going to talk about is how you fix this. And there's two main ways to do this. One way to fix your posture is through behavior modification. And then the second way is I'm going to give you 3 exercises you can do that are very helpful. So behavior modification. Start taking breaks from your devices. Instead of go ahead and looking down in your lap all the time, just get in the habit of getting things up at eye level and doing things here. This feels weird at first to be here doing this, but it's much better. You can see from this lateral view my neck is straighter. A thing that I really like to do is have people stand next to a wall and have a family member or somebody set up and take a photo. So stand next to something that acts like a plumb line, a straight wall of some sort, and stand there with how you usually stand. So if you're usually like this, stand there, take a picture, and then try and straighten up and take a second picture. Tuck your chin in a little bit, work on your position. You'll feel maybe some pulling or your stomach muscles or some different muscles working a little differently, but straighten up, take a second picture, and then look at them yourself. You'll be surprised at what a difference your spine looks like, because you may not even be aware of how curved forward you are until you see it. So I really like having people take a photo of themselves to see the contrast of how poor their posture has come over time, because they just don't realize it. So that really helps with behavioral modification, because you then become much more aware. When you're sitting, same thing. Don't cross your legs. Don't do this, what we call figure 4 sitting. Crossing your legs like this will make your butt muscles fall asleep, start to pinch your sciatic nerve, compress your back or twist your back. I sometimes see people coming in, they've been sitting like this up on their foot. That tends to cause a big shift in the pelvis, and then they have this obliquity or twist in their pelvis that's an issue. Another thing people do is they tend to long sit. So they're sitting with their legs crossed up like this. It's nice and relaxing, but now you're tethering your system and really pulling on your nerves and putting a prolonged stretch on them. And our nerves just don't do that well with a prolonged stretch. They can deal with compression, but stretching them longer than 30 minutes in the sustained posture starts to cut off blood flow to our nerves, and now can create some sciatic symptoms, some foot pain, and some other issues going on with your system. So getting your feet on the ground, limiting your sitting time to 30-40 minutes, then take a break, get up and move around, work on your sitting posture, get a sit-stand desk, get the proper ergonomics set up at home to raise up your laptop and get a wireless mouse and keyboard so you're sitting nice and straight and lined up. And then start modifying your habits that cause you to go into a bad posture. So the last thing is 3 simple exercises. There's a lot of things you can do exercise-wise, but I really like these 3 exercises for helping you to correct your posture. You want to kind of stretch some of the tight muscles pulling you forward, maybe in your hips or your chest, and then strengthen some of your back muscles to open up and hold you in this more upright positioning to fight against gravity and slumping forward. So the first exercise I like to do is you go ahead and lace your fingers together. You can put them here at your shoulders or behind your head, and then you're just going to actively bend over the back of a chair. Make sure you're not in wheels and you don't tip over in the chair and hurt yourself, so be careful. But you can go ahead and tip backwards like so, and I'm not cranking through my neck, but you want to move through your elbows. So your elbows are where the motion's coming from, going into this position back and forth. So that's a nice way to get a little bit of thoracic mobility. You do 10-15 of those several times a day. The second exercise is a wall slide. This strengthens the middle trapezius, lower trapezius, and then it stretches the front of the chest. This is a great way to kind of strengthen. You're going to find sometimes this is quite difficult for some people, but you put your hands like you're going to say touchdown here, and then you're just sliding all the way up straight and then coming back down. So you're sliding up and then back down. 10-15 of these, stretching the front of your chest and strengthening your mid-back. And then lastly, because a lot of times we're sitting, the hip muscles get tight. So stretching the front of your hips out is a nice way in standing for this third exercise. You just kind of pull on that quadricep, pull the stomach in here, and then you can raise an arm up if your balance is good enough, or you can hold on if you need to, and just kind of stretch out the front of your hip from prolonged sitting. Of course, doing the other side, maybe a 20-second hold, and then repeating it a few times on each side, several times a day, to offset that prolonged sitting. So make sure that you're taking care of your health and you're watching these things and correcting your poor posture and moving forward so that you can live a healthy lifestyle and age well, looking great, and continuing to be active. Thank you for watching, and please share this video if you enjoyed it with your family and friends. Thank you.